Hey guys, what's cracking? Dr. Eric Smith at Papa Chiropractic, and today I have Denise. How you doing today?
Pretty good.
Good. So this is your third adjustment?
This is my third adjustment. Yes.
Awesome. So I got to meet you because you were working in a restaurant. We got to talking about the back, and then you're studying neurology soon. What
I am studying neurology. So I'm interested in cognitive behavior and how what we eat forms serotonin in our gut, and how that affects our brain, how we decide to behave in life, etc. But yeah, no, you met me at the bar, and when he said he was a chiropractor, I was like, I need to see you because we're bent over all the time, and then I'm studying, so I'm over a computer all the time, and my posture, although I try, is not the best.
Yeah, so we're starting to work on that a little bit more. So everything that she does, and when you think about chiropractic and some of the holistic things we do, is a great tie-in here because she's looking at what happens in here, how it affects the brain, and the neurology part of it. So we started nerding out about some neurology, and then she had a question earlier, which is a great question a lot of people have, which you asked me kind of a little bit about what?
Yeah, so I was wondering, I'm 29, almost 30 now, and it feels like everything's starting to crack. And we make jokes about it, that we're getting old, but I'm like, is that really the case, or am I doing something wrong, right? Because I do lift, but I'm not the most consistent.
Yep. So very good question. So usually what happens after you start getting adjusted or you move around, you'll probably notice you get some more natural pops and cracks out of your body. Now we're going to break that down into two different things. For those of you who want to know more about this, and those of you that are watching and love the videos, make sure you like and subscribe. Go ahead and hit that bell below so you can make sure you get more of our videos as we'll be putting out more content. But to answer that question, so your joints themselves should be freely moving, and you got to think a muscle attaches to the bone. The bone should have some joint play in it. So when you see chiropractors palpating, that's what we do when we're pushing on the spine. We're feeling for joint play, so it should have some elasticity to it and some movement. If it doesn't, that tells me where I need to adjust. So as we're working on her posture, getting her shoulders back and fixing some of those things, when I started to get some of that moving, now because she's still working out, now that we've been adjusting, you're probably thinking more about your posture, right? So she's thinking about that more and things are starting to change. So with that being said, they're not becoming as fixated as they were before. So therefore, she can move and she's doing the right movements to get that to go. Now, you're doing that with natural movement. She's not like grabbing a door or popping her back across the bar or at the restaurant or something like that. It's just natural movement. So that would be the joint aspect. The cavitation is the triple word score, if you want, or this on Scrabble, for what an adjustment that noise is, that pop, that crack. So the other thing she asked me about was like a snapping. So a lot of people will have a snapping hip. I did a video on this as a short on YouTube if you guys want to look for it. But if it keeps snapping, so if it's something where you can go and it keeps doing that, that's not the joint being fixated. That is literally just the tendon attaching and snapping over a piece of the bone. So there's probably a tight muscle that we need to fix. So, but that was a really good question because a lot of people are like, oh my gosh, I pop and crack more. Is that a good or bad thing? Should I do that? If you can naturally move and get the pops and cracks, then that's not a bad thing. So with that being said, some of the stuff that we're going to work on with you today is I'm going to continue to work on this neck, and I've obviously done an exam on her. This is her third visit with us, but just to kind of show you where we're at today, see where she's at. Middle of the neck's tight again, I see, or feel. So look at her range of motion. So she's a little restricted. Should be able to get your ear all the way over there. So note that because later in the video we'll be measuring that again. So how do you feel when we go back here?
Oh, it does feel tight.
It does feel tight.
Yep.
Okay. So everybody's a little bit different with what their norm is. And good rotation through there. Squeeze your shoulder blades together. So she can get into extension really well, which is awesome. And then shoulder wise, she can get overhead real easy. Really smooth in the shoulders. Good.
So this is actually where I feel the pop. It's like right here.
So when you do that, and you feel it in your back, or where do you feel the pop?
I feel it right here.
So she's feeling it in her upper thoracic. So if you want to take a look at this, this is basically what she's feeling. If you let that relax. So through here, she can get into extension real well. So if you lean forward for me, please, head down forward. So through here, you really can't probably see this too well, but she's a little flat through here. This is where I like to do the anterior to posterior adjustment, where I have you laying on your back to induce a natural kyphosis or to get these thoracics to open up. So when she's doing that, do that again. She can really like force herself in extension quite a bit. So it's pushing them forward as well as probably getting some pops and cracks out of the ribs that are there. So the thing about the thoracics that make that different from the low back and the neck is in the thoracics, you have more articulations of the rib heads that come in there. So a lot of times if somebody said, or if you've seen a video where somebody had a rib head out, and you'll know because it'll hurt when you breathe, like, you kind of almost feel like, especially if it's on the left side, a lot of people go to the hospital thinking they have a heart attack because the ribs kind of come around. But with her, she can do that. So it's a good and bad thing because she, like when she wants to, she can really present with great posture, right? And then the problem is when she does that too much, similar to me with my back, is that you actually end up jamming these joints a lot. So that's where we'll do a few different adjustments on certain things, but go ahead and cross your arms over your chest for me, please. So just to check out her rotation over thoracics, a little tight through there, a little more tight through there. Okay, let's go ahead and have you lay face down for me, please, with your arms down on your side. Let those rest there. So a couple things that we're going to look at here is just her feet, kind of see where we're at. Too far off there. We want to definitely get some movement in there. As we kind of palpate and push around here, this is what I was talking about when chiropractors do this joint play thing. They're pushing in to see if there's any asymmetry, and I get my thumb in a little bit more there. And then when we look at where her, what people would call their hips, but it's the top of your pelvis, her right side's a little bit higher, so she's shifted like that way. A little sore in there at all?
Yes.
Okay. How's this glute been? Any soreness?
Not much.
Good. Let me know if you feel any.
No, it's really just like right here.
So right at the bottom. So with her, she has a good sized curve here, a little flat through here. So she has a little bit of what we call sway back. And what sway back is at the lowest part of the spine. It's got most of the curve, and then she starts to go posterior or backwards there. Instead of having a natural lumbar curve in there, she's got more pressure down here. So, which is good because I believe from the story you told me, you're starting to fix that.
Yes, it was I basically had, this was a lot more curved before, and then my neck would just drop down, so now my neck is aligning a little bit better so that the top of my spine is a little bit straighter.
Yep, that's good. So future doc here, you know, it's good to like talk with her about these things. And she was making notes as I was telling her earlier. It's pretty funny. So, but then she's really jammed up quite a bit in there. So this is the area that's a little flat. We already kind of knew what was going on there because even though I push here, her general function and her motion is what matters the most. So very cool. So I'm going to get some pressure off the lowest part of her back. Most people that have sway back, they tend to have the most pressure on the L4, L5, which you have 5 lumbar vertebrae. So the 2 at the very bottom. So I like to use this table just to stretch out some of the joints to get some pressure off there. And usually patients say this feels pretty good.
That's my favorite part.
It's her favorite part. I was going to rob her of that. So the biggest reason that a lot of people like this is because gravity's pushing this way on you instead of down. So I get to open these joints up in the back a little bit more, and then her muscles are relaxing and allowing that to happen. So the more you can just open these joints up and get some pressure off the facet joints, which are in the back, you can also usually get some pressure off the discs. So those of you that have low back pain with disc issues, or they have other things going on with your low back, or if you've herniated a disc, this could be something that could help you. And if your chiropractor is not doing this and they have a table to do it, just please ask them if they can do that for you. But a lot of times your practitioner may or may not have this table to be able to do it. So they're not robbing you, it just might not be something that they do. So I like to do that just to kind of get some pressure off there and then go from there. So let's get some in here. Nice deep breath for me. Let it all the way out. Good. Very good. And as I said, she's kind of flat through here, so I normally don't like to push that more forward. So I'll pressure up here. Let the neck relax for me. Good. Awesome. Go ahead and lay on the right side of your body. So how many times have you been adjusted before I saw you?
I actually had seen 2 other chiropractors. I was going regularly, maybe for like 2 months at a time with each one.
Nice. Let this relax for me. Good. Good job. Let's lay on the other side. Let that relax for me. All the way out. Good. On your back. Okay, let's get this tricky neck of yours. So she's got good range of motion for the most part in her neck. But right through here is the middle part of the neck. And a lot of people lose that cervical curve that you're supposed to have. So when we talk about cervical curve, it should go forward. Instead, a lot of people will get a straight neck and then it'll become reversed. So this is usually where a lot of people have the most pain. So
Yes.
let that relax for me. Great. Woo!
Oh, great.
Oh, great. That is what people came for. They came for the cracks. That was good. You did a great job relaxing. So right through there, this is usually like your C3, C4, C5 area. There's 7 cervical vertebrae. So most people have the most tension in there. How's this lower or this upper neck tension been?
I feel the tension right there.
So I know we were saying before, looking at range of motion, so before we couldn't get her ear to her shoulder, right? When we had her sitting up and then boom. So that's kind of the power of an adjustment to get that natural range of motion back. The other part of it is that you're not using your muscles right now. You let me relax and do that. So let's have you slide down the table a little bit more so I can get that middle part of your back. Okay, so let's get that middle part of your back now. So as I talk about that middle part of her back right there is kind of flat. So what I like to do with the adjustment is just like this. Okay, tuck your chin to your chest. Oh, nice deep breath. And go all the way out. All the way out. Relax for me. Oh.
Oh, yes.
That was good.
Yes.
Lots of pops and cracks out of that one. So that's the area that most people get pretty fixated is that thoracic. So if you're pitched forward or you're not moving through there, then your neck isn't going to do that motion that we really, really want because the spine works all together. That's why even though she's complaining of upper back and neck pain, I like to adjust the low back to make sure we're there. So, and since she uses her hands a lot, how's it been? Good?
You know, I thought it was from bartending that my wrists were locking up, but I think it's from typing.
Ah.
Yeah, I realized I think how I'm placing my wrists on the table, maybe height-wise, towards the keyboard, I think it's putting some strain on my...
Okay, cool. So yeah, I just like to make sure the wrists are good, but you've had no problems really with these?
It's been better. It's been better recently. I've been just like moving them crack. Like there's no crack anymore just because I've been trying to incorporate more mobility into my wrist. And I actually went on Amazon and found something like the same way I foam roll my back. I found something to foam roll my wrist.
Really?
So I'm gonna open it up today and see how that works. Yeah.
Okay. Well, I'm excited to hear about that because I don't know how that's gonna go. How have the ankles and such been?
The ankles have been better. I feel more stability.
Okay. So because she's lifting, she's doing a lot. So I just want to take a look at the ankle. So I want to make sure she has a lot of good what we call plantar flexion, but she's a little restricted in dorsiflexion there. Plantar flexion is really good there. A little bit more here, but did you hurt this one in the past? I can't remember.
So it was actually this one that kept getting sprained in track. I ran track in middle school.
Yeah.
And it was this one. And I sprained this knee twice, bodybuilding.
There we go. She's got a few injuries to work with. So let's get this bad boy adjusted. Just relax for me. Good. Nice. Excellent. So for knees, usually what I like to do is just kind of mobilize. And this is your femur, this is your tibia, just to sit on there more. Because usually what will happen is they'll get a little twisted, and then that can push on your meniscus, and then you'll usually have pain like it. So especially with you lifting more, and you're proud of you, getting back in the gym, doing your stuff, in the middle of getting ready, doing all your classes.
This knee, I feel like when I lean over my mirror, let's say I'm doing my makeup or something, it feels like it's hyperextending. Maybe I'm hearing like a click, like my leg gets too straight.
Oh, okay. Any pressure? Does it hurt when I do that?
It doesn't hurt.
Okay. Any pressure when I bend?
No.
Okay, so I'm just gonna do a little bit of traction, kind of move that around and get that to reset with this. Feel good?
Yeah.
Let's check you out. Go ahead and sit up for me, please. I'll have you face that way. So we can see how you do when you move it. Try to take your left ear to your left shoulder for me, please. Good. A lot closer. Let's go to the right side. Good. Take your head back for me. Awesome. Bring your shoulder blades together. Feel that pinch at all? A little bit?
Yeah.
Okay. Sounds good.
Yeah, so it feels better.
Awesome. So this is what I typically do as we're like moving through care. So she's in the first phase of care right now, which is really just reducing pain and restoring range of motion. Next phase that we go to is really where the spine's going to take a lot of that work that we're doing and restore and keep it. So she's doing a lot of strength training, which is the third phase, which is strengthening and making sure it doesn't go anywhere. So for those of you that have any questions about this type of treatment, anything we did, you can follow this one. I'll put the link below. So put a link to your bio as you go into all of your further schooling and anything else. And maybe even if she likes and I approve of the foam roller for the wrist you said, yeah. We'll put that link below too. So thanks for watching, like and subscribe, and we'll see you next video.